Good afternoon, everyone. My name is Shirley Blakely, and I work at the FDA Center for Food Safety and Applied Nutrition. My job title is Senior Nutrition Policy Advisor. And it's my privilege to welcome you today to this webinar. It is being jointly sponsored by FDA and CIFSAN. We are located in College Park at the Harvey Wiley Federal Building on Paint Branch Avenue. Some of you may have visited our building in the past. I want to tell you a little bit about the webinar series. There's a new format. On your evaluations, requested that we break it down, allow each presentation to be a little bit more in depth, a little bit longer, rather than 30 minutes, maybe 45 minutes, and then allowing more time for questions and answers. So this webinar series is to demonstrate that we have heard your request and we are giving this a try. So we'll have 2 webinars this spring and then 2 in the fall. Our next webinar will be on April the 20th. That title will be Gluten-Free. And the webinar today is about menu labeling. So the webinar is shorter in duration. We have a 2-hour time span. So there will be more time for discussion. So the goals are to provide comprehensive coverage of the final rule that was published last December on nutrition labeling of standard menu items in restaurants and similar retail food establishments. And we will be abbreviating that as SRFE, as you will hear later on in the presentations. We will also be talking about calorie labeling of articles of food in vending machines. And there are some learning objectives that are specific to the content of the presentation, so please listen carefully. These learning objectives relate to the criteria a restaurant and similar retail food establishment must meet to be covered by menu labeling law. It lists some of the information that's included on a menu board and describe how covered establishments can determine their calorie content and how operators of vending machines can display calorie content. As I mentioned earlier, this webinar is co-sponsored by the Joint Institute for Food Safety and Applied Nutrition, and we abbreviate that as GIFSAN, which is affiliated with the University of Maryland here in College Park. The first person you heard today was Kyle McKillop. He is our Information Technology Manager. He works for GIFSAN, so I want to thank Kyle for all of the work he has done to get this going. So again, it's my privilege to welcome you to this 2015 FDA GIFSAN Food and Nutrition webinar series. Please, I know some of you have registered for the webinar, today's webinar, as well as the one on April 20th. So we hope you will enjoy the content and and learn a lot about this new rule. So again, welcome. And so our next presentation will begin shortly.
Good afternoon, everyone, and I'd also like to welcome you to the jointly sponsored GIFSAN and FDA webinar this afternoon to discuss the final rules for restaurant menu labeling and for vending machines. My name is Felicia Billingsley. I am the Director of the Food Labeling and Standards staff in the Office of Nutrition, Labeling and Dietary Supplements here at CIFSAN. And me and my staff have been diligently working to finalize the rules and now move forward to education and implementation. I also want to thank GIFSAN and FDA for this opportunity to share with you highlights from the new restaurant menu labeling rule. And we do believe that once fully implemented, these rules will go a long way in assisting consumers in making better dietary selections when they eat away from home. This afternoon, I'll be focusing on these particular areas as we go forward with the presentation. I'll talk a little bit about the actual law that amended the Federal Food, Drug, and Cosmetic Act to require menu labeling. I'll talk about the definitions that we established in the final rule, give some highlights of the specific requirements of the final rule, discuss a few other relevant issues, describe what we're doing now in terms of moving forward, and then have time after both presentations for questions and answers. So let's talk a little bit about Section 4205 of the Patient Protection and Affordable Care Act. I'm sure many of you saw on the news yesterday that it was the 5th anniversary of the signing of the law. As you can see, it was enacted March 23rd, 2010. As I mentioned, it amended certain provisions of the Federal Food, Drug, and Cosmetic Act, and it covers menu and vending machine labeling. We issued proposed rules on April 6, 2011. To the menu labeling proposal, we received about 900 comments, and to the vending machine rule, we received about 250 comments. My colleague Dan Reese will talk more about the vending machine labeling requirements. So who is covered by Section 4205? According to the provisions in the law, the rule applies to restaurants and similar retail food establishments that are part of a chain with 20 or more locations that are doing business under the same name and offering for sale substantially the same menu items. Section 4205 also had specific provisions for voluntary registration for restaurants and similar retail food establishments that wish to be covered by the federal rules. Specifically, Section 4205 requires that covered establishments that meet the definition must post calorie information on menu and menu boards for standard menu items listed on the menu or menu board, must post calorie information for standard menu items that are foods on display or self-serve foods, must post a succinct statement concerning daily caloric intake, must have additional written nutrition information for standard menu items, and must post a statement that the additional nutrition information is available to consumers upon request. I'll note here that neither the specific wording of the succinct statement nor the statement of availability were actually included in the law. So this was one area where FDA had to develop appropriate statements to meet these two requirements. This slide lists the key components of the menu labeling final rule. As you will notice, there are certain bullets that have been highlighted or bolded. These particular bullets represent changes between the proposed rule and the final rule. As I go forward in the presentation, I'll speak to those in particular to explain what we proposed and how the rules changed prior to it being finalized. So let's have our first poll question. You will see a box to the left called poll. Please select the choice to respond. And the question is, what are the criteria that an establishment has to meet to be covered? A, be a chain with 15 or more locations. B, be a chain with 20 or more locations. C, be owned by the same corporation. D, do business under the same name. E, sell substantially the same menu items. F, all of the above. G, A, C, and E, or H, B, D, and E. So I'll give you a few moments to select your answer. Well, it seems like most of you have been paying attention or you've really been following the rule. because 81% did get the correct answer, H. B, D, and E. You must be a chain with 20 or more locations, do business under the same name, and sell substantially the same menu items. Very good. Let's move on to talk about the definitions that were developed and designed to help clarify what entities are covered, what food is covered, and who is authorized to register a facility that voluntarily decides to be covered by the menu labeling rules. We'll go into a little bit more detail on each of these definitions. Let's start with the covered establishments. So establishments that are covered are those, as I've mentioned, that are part of a chain with 20 or more locations, doing business under the same name, and offering for sale substantially the same menu item. Now, the law itself described these establishments that were subject to the requirements as the 3 items I've just identified. However, the Act did not go into any more detail about these prongs, nor did it provide any definitions. As we considered these criteria when we were developing the proposed rule, we recognized that there was no clear description of any of these terms, and in particular, no text to distinguish the difference between a restaurant and a similar retail food establishment in the actual law, nor any reference to our existing statutory language. So in trying to develop a means to identify a similar retail food establishment, we considered several ways to describe the similar retail food establishment that would differentiate it from your traditional quick service or sit-down restaurant. In the proposed rule, we proposed to have a primary business test criterion. Establishments would be covered if the sale of food is the retail establishment's primary business activity and the establishment presents itself or has presented itself publicly as a restaurant. Or the second prong, a total of more than 50% of that retail establishment's gross floor area is used for the preparation, purchase, service, consumption, or storage of food. There was no clear consensus in the comments on the proposed primary business test. Several comments noted that it could be difficult or cumbersome for regulators to have to determine gross floor space used for food service in order to determine whether a facility was covered. Further, different facilities doing business under the same name could have different floor space allotted for food versus other services. So there also could be challenge within the establishment or the chain of establishments to determine whether they were covered or not. We also got many comments that questioned whether other types of establishments, for example, movie theaters, should be covered, or if all of the foods in a grocery store would have to be covered. After considering all of the comments, we determined that the best approach to meet the spirit and intent of the ACA was to abandon the primary business test criterion and revise the definitions to those that you see listed on the slide. So for an establishment to be covered under this rule, it has to be a retail establishment, a restaurant or similar retail food establishment that offers for sale restaurant-type food, part of a chain with 20 or more locations, and we define those locations as fixed locations. So certain types of food trucks, trains, airplanes are not covered by this rule. The third criterion is that they must be doing business under the same name, and this is represented as the name that's presented to the public or the name of the parent entity if no name is presented to the public. For example, a concession stand and a stadium. This includes slight variations of the name as well. For example, you may have ABC Northeast or ABC Southwest, because of the location and a particular region they may be in, or you may have ABC Store and ABC Express that's in the airport. The fourth criterion is that they're offering for sale substantially the same menu items. And this is defined as a significant portion of menu items that use the same general recipe, are prepared in substantially the same way with substantially the same food components. And this applies even if there is a slight variation in the name as indicated on the slide. As I noted, restaurants and similar retail food establishments that do not meet this criteria but choose to be governed by the menu labeling requirements can voluntarily register with FDA. And if a firm or an establishment voluntarily registers with FDA, they will be covered in the same manner as those establishments that were identified in the law. So in essence, when it comes to covered establishments, we broadened the types of establishments that were covered in the proposed rule, but narrowed the types of food that would require labeling to restaurant-type food. This slide just offers some examples of facilities that are covered, and most are, I'm sure, are clearly recognizable to you. We did include and clarify that entertainment venues such as movie theaters and amusement parks are covered by this regulation. And we also noted that some managed food service operations may be covered depending on how they prepare and serve food to customers. So as I mentioned, in the final rule, we consolidated and revised the definition for restaurant-type food. In the proposed rule, we had two definitions, one for restaurant food, which was the type of food sold from your traditional restaurants, and then restaurant-type food as that type of food that would be sold from a similar retail food establishment. But in considering the comments and revising our definition for covered establishment, we consolidated the definitions for restaurant foods and restaurant-type food to be food that is usually eaten on the premises while walking away or soon after arriving at another location, and either served in restaurants or other establishments in which food is served for immediate consumption or which is sold for sale or use in such establishment, or processed and prepared primarily in a retail establishment and offered for sale to be consumed elsewhere, and which is not offered for sale outside such establishment. It is important to note here that the two bullet points represent statutory language that was actually established as part of the Nutrition Labeling and Education Act of 1990 and should be considered in determining whether food sold in a grocery or convenience store or any other covered establishment is covered. If the food does not meet all of these criteria, it is likely that it was never exempt from nutrition labeling under the Nutrition Labeling and Education Act and should already have nutrition labeling on it. So I would encourage you, as you look at your own situation, to be sure that the foods that are under consideration for labeling with regard to the menu labeling requirements are properly labeled and aren't foods that were never exempt under NLEA. Most of the examples on this slide as well are recognizable as restaurant-type foods. We clarified, however, that for food sold in a grocery store, it would be food that is offered from a menu board, or food from in-store facilities like salad bars that are intended for immediate consumption. To help bring some more clarity around the question of what's considered a restaurant-type food, I thought it would be helpful to include some examples of foods that we do not consider to be restaurant-type foods. Foods that are generally more like grocery store items and intended to be eaten over several eating occasions are not covered. Examples in this slide would be loaves of bread or whole cakes. Foods that require further preparation before consumption would also not be considered restaurant-type foods, as well as foods that are neither self-serve or intended solely for an individual. The examples here are like deli salads, large quantities of items that may be sold by weight. Bulk foods that are customarily sold in the aisle of a grocery store, for example, nuts and dried fruits, are also not considered restaurant-type foods and therefore not covered by the final rule. Similar to how the Act did not include specifics for covered establishments, it also used several terms in describing the foods that would require calorie labeling, but did not include in-depth definitions or descriptions of these foods. As a result, FDA had to interpret what Congress intended to be covered, and we established the following definitions in the final rule. A standard menu item is a restaurant-type food that is routinely included on a menu board or routinely offered as a self-serve food or food on display. The law also identified combination meals. These are standard menu items that will consist of more than one food item. They may be on a menu board and presented in a narrative form. They could be numerically, like a number 1 or a number 4, or pictorially. And typically, these combination meals will have several items that have been combined for a single price. They may include a variable menu item, or in some cases may actually be a variable menu item themselves. So what is a variable menu item? Well, that's a standard menu item that comes in different flavors, varieties, or combinations, and is listed as a single menu item. So again, it would be a single entry, a single menu item with a single price point. The other two types of foods that are covered include a food on display. This is a restaurant type food that the consumer can see before making a selection. And this applies as long as there is not an ordinary expectation that further preparation has to be completed before the product can be consumed. And then you have your self-service food, restaurant type food that is available at a salad bar, buffet line, cafeteria line, or similar self-service facility. And that is served by customers themselves. And the law specifically included self-serve beverages in this particular category of foods that are covered. We are also covering alcoholic beverages in the final rule. Alcohol beverages were not included in the proposal, but many comments supported inclusion of alcohol beverages because of the caloric contribution of alcohol to overall caloric intake, because the law did not specifically exempt alcohol beverages as it did other types of foods, and because they are a food within FDA's jurisdiction. Thus, restaurants and similar retail food establishments that have alcoholic beverages either on the menu or menu board or as self-serve will be required to disclose calories. How the calories will be disclosed depends on how the beverages are listed on the menu, and I'll talk a little bit more about actual calorie declarations further in the presentation. The rule, however, does not require calorie declaration for alcohol bottles that may be on display behind the bar. Section 4205 of the ACA also identified foods that were exempt from nutrition labeling. Custom orders include items that are standard menu items where the customer asks for a change in the standard build of the food. For example, a sandwich that normally comes with mayonnaise and the customer asks to have ketchup and mustard instead of mayonnaise would be considered a custom order and therefore not required to have calorie declaration. Daily specials are items that are only offered on certain days. A daily special, however, does not include a menu item that is always on the menu, but is offered for a cheaper price on every Monday, for example. Daily specials could also be covered under temporary menu items if the food is only offered once per week. We've received questions about items that might be added to a salad bar that are not routinely offered but may be used as a substitute for another item or added to prevent food waste. If the food item is not a standard menu item and is only offered either as a particular item for that day or is only offered under temporary conditions, then it would not be required to have nutrition labeling. Also, foods that are part of a customary market test are exempt from calorie disclosure. A food is considered part of a market test if it is on the menu for less than 90 consecutive days. Now, it is possible for a food to be test marketed more than once per year, but if it is the same food item, the agency would expect that it is significantly different than the previous item that was test marketed, and the formulation may have been changed to address consumer preference or comment. Temporary menu items are foods offered for less than 60 days per calendar year. Now, unlike the customary market test food, these days do not have to be consecutive days. They can be several times during a year, but in total, the number of days that a temporary menu item is offered for sale cannot be more than 60. So let's say that a menu item is offered for 15 days at the beginning of the year. You have an additional 5 days to use throughout that year that the item can be offered and the item still be considered a temporary menu item. General use condiments are also exempt from the menu labeling requirements. And these are foods that are available for general use. An example might be a flask of pancake syrup at a pancake house that's on the table, bottles of ketchup or mustard. Additional foods that are exempt would be those that are not on a menu or menu board and are not on display or self-serve. These foods are not considered standard menu items and therefore are not covered by the labeling requirements. We also included definitions in the final rule for menus and menu boards. Menus and menu boards are defined as the primary writing from which the customer makes an order selection, and it does include takeout and internet menus. A restaurant or similar retail food establishment may have several menus that require calorie labeling. For example, specialty menus such as dessert or drink menus or children's menus are considered primary writings, and this is from the perspective of the customer and require calorie declaration. In considering whether a writing would be a menu depends on whether the customer can use the writing to place an order. For example, a writing that has the name and price of the item could be used to place an order. If it is a writing that is delivered in the mail and it contains the name and price of the item and a phone number or internet information where orders can be placed, then it would be considered a primary writing and would require calorie labeling. We've received questions about things like table tents and coupons. Again, you have to view these types of writings as to whether a consumer or a customer could use this information to make an order selection. If it doesn't have all of the necessary information to complete an order selection, then it would likely not be considered a menu or menu board. So we have our second poll question. A daily special is a standard menu item that is on the menu or menu board and offered every day, but offered at a special price on every Wednesday. Again, you will see a box to the left called poll. Please select a choice to respond. Again, it seems like you're right on the money. 70% of you that responded with the correct answer, and that is B, false. A daily special is offered on a particular day, and it is not a standard menu item that is on the menu board every day. It's very good. Now, to get into a little more of the specifics of what is actually required by the final rule, I want to first talk about displaying calories on menus and menu boards. The overarching purpose of the rule is to require calorie disclosure on standard menu items offered for sale in covered establishments. We have issued a rule that allows considerable flexibility in how calories can be disclosed for standard menu items. For menus and menu boards, the calorie declaration must be adjacent to the name or price of the menu item in a type size no smaller than the smallest type size of the name or price, in a color and contrast at least as prominent as that for the name or price, and should include the word calorie, or we've also allowed for the abbreviation cal. As you can see here, the requirements, again, are flexible. The information needs to be clearly associated with the standard menu item, but how that is accomplished on your particular menu or menu board is really going to be dictated by how that menu or menu board is developed. For menu items that come in different flavors or varieties that are listed as a single menu item, the calorie declaration will either be presented with a slash or a dash. If there are only two options, a slash is used, but if there are three or more options, a range with a dash is used, where the first number represents the lowest calorie declaration and the second number represents the highest. If the different flavors or varieties are listed as separate menu items, or each flavor or variety is listed on the menu and menu board, then the calorie declaration would have to also be listed for each flavor or variety. But again, we've tried to provide flexibility in how this information can be declared, and flavors or varieties that would have the same calorie declaration can be grouped within a single declaration. The rule does not require a covered establishment to create a new menu or menu board where they do not have one, or redesign an existing menu or menu board into a particular or specific format. I really want to reiterate that because we have, again, gotten a lot of questions in terms of, well, if I don't currently have a menu or a menu board, am I required to create one? The law does not require you to create a new menu or menu board. We've also given some guidance on if columns are used on your menu, how the declaration needs to appear. So if on your existing menu or menu board, a column format is used, the term calories or cal must appear at the top of the column in a type size no smaller than the name or price of the menu item, whichever is smaller. And we anchored the calorie declaration to the name or price because those are the two primary features of a menu or menu board that a customer uses to make their selection. So if the calorie declaration is as prominent as those two required pieces of information, it gives assurance that the calorie declaration will also be prominent and be seen. I've included an example here of one way that calorie declarations may be declared. I would describe this as a string format, which is also acceptable. As you see here, the example is a grilled burger. It lists the fixings that come on the burger, the price, and then the calorie declaration. These are just additional examples of how calorie declarations can be disclosed. The first is a variable menu item, and here the first example has two options. You either get a grilled chicken sandwich or a fried chicken sandwich, and as you notice, the declarations are separated by a slash. The second example has three options. You can get a grilled, baked, or fried, and there we've used the dash to identify the calorie range. For a combination meal, a cheeseburger with choice of side salad or chips, Here you have two options. You either have a cheeseburger with a side salad or you have a cheeseburger with chips. Therefore, the calorie declaration is separated by a slash. In the second example, it's a combination meal with a variable menu item. So it's cheeseburger with choice of side salad, fruit, or chips. And again, the dash is used. Another example showing a column format. Same examples with the chicken sandwich. I've included here soft drinks. So if just the term soft drinks would be used on a menu and menu board, you would then use a range for all of the available soft drinks. However, if the beverages are specifically listed by flavor, then you would list each declaration adjacent to the flavor declaration. But if you noticed here, I have grouped Diet Cola and Diet Lemon Lime because those two flavors would have the same calorie declaration. Another example of how calorie information can be declared. In this particular example, you have a variety of sides that could be offered with various sandwiches and burgers. So if your menu is written in this format, you can certainly declare the calories after each side that's identified. So you have the calorie declaration for French fries, fresh fruit salad, a cup of soup, and I draw your attention here because the cup of soup apparently is a variable menu item, and it has more than 3 options of soup that can be added to your burger or sandwich. And finally, yellow rice with black beans. Then beneath that, you have the calorie declaration specific to that burger or sandwich that's offered. So how this menu would be used is that the customer would add the 2 or 3, if they wanted more than 2 sides, calorie declarations together to get the total amount of calories that they would be consuming in their selection. Similarly, how calories are required to be declared for toppings will depend on how the toppings are listed on the menu and menu board. If just the term topping appears on the menu and menu board, then the calories can be declared using a range. However, if each topping is individually listed, then the specific calorie disclosure will be required. But as with flavors or varieties, toppings with the same disclosure can be grouped. If certain toppings are listed on the menu and others are only on display, then only the toppings that are listed on the menu are required to have the disclosure on the menu and menu board. The toppings that are not listed on the menu but are either on display or self-serve will require the calorie disclosure in the same manner as other self-serve foods or foods on display. And that's adjacent to or clearly associated with that food on display or self-serve item. FDA has also provided flexibility for calorie disclosure for multi-serving foods. The calorie disclosure must be listed for the entire menu item if the food is ordinarily prepared and served as a single serving, regardless of how many the menu item may serve. So a bowl of some type of dip, like a guacamole dip that is served in a single bowl, the calorie declaration would need to be for that entire bowl. Now, what we did in the final rule was to also provide an additional means for declaring calorie declarations for multi-serving food items. This is only, however, for multi-serving food items that are normally prepared and served in discrete units. When that is the case, the calorie disclosure can be listed per individual discrete unit, provided that the total number of discrete units per item is also declared. So in the proposed rule, we had only said that a multi-serving food would have to declare the entire calories for that standard menu item. But in the final rule, as I've just noted, we have allowed for calorie declaration per discrete unit when the food is prepared and offered in discrete units and the number of discrete units are also disclosed. Here are a couple of examples of how calories can be displayed for toppings. The 2 examples here, one is for an ice cream and the other is for a pizza. For self-serve foods or foods on display, the calorie disclosure must be on a sign near the food that can be viewed at the time that the customer is making the food selection, and must be per discrete unit or per serving utensil if the utensil dispenses a uniform amount of food, or per household measure if the serving utensil does not dispense a uniform amount of food. For self-serve beverages, the calorie declaration should be per fluid ounces that will fill the cup. Similar to menu calorie disclosure, the type size of the calorie declaration can be no smaller than the name or price of the item, whichever is smaller. And the types of signs that can be used, again, we've allowed a lot of flexibility here. It can be viewed while at any point of a salad bar. It can be smaller signs on a sneeze guard. We really have tried to provide flexibility so that the establishment can determine what works best for them while still complying and providing the information required by the rule. Our third poll question: the final rule requires that covered establishments create or redesign a menu or menu board to meet the requirements of the rule. True or false? Again, you will see a box to the left called poll. Please select a choice to respond. Your answers keep getting more and more correct. We now have 95% that answer correctly, and the correct answer is B, false. Now let's talk a little bit about the two statements that are required to appear on a menu or menu board or for foods on display or self-serve food. Section 4205 requires a statement that will help put the calorie disclosure in a context that will be understandable to consumers. We refer to this statement as the succinct statement. And the statement is listed on your slide. 2,000 calories a day is used for general nutrition advice, but calorie needs vary. I want to note that this is the only statement that will meet the requirements of the rule, other than the statements that we have provided specifically for children's menus. Restaurants and similar retail food establishments may use additional information on their menu and menu board, but this statement is the statement that meets the requirements of the rule. In the alternative, if you do have a children's menu, we have provided in the rule alternate statements that can be used in addition to this statement on a children's menu or alone on a children's menu. For multi-page menus, the succinct statement must appear at the bottom of each page of the menu, above, beside, or below the statement of availability. The type size of the succinct statement can be no smaller than the smallest calorie declaration appearing on the same menu or menu board with similar color and contrast requirements. The law also requires that covered establishments provide additional nutrition information to consumers upon request. The additional written nutrition information includes most of the information required in nutrition labeling for packaged foods, and it is clearly listed in the final rule. The rule provides flexibility in how the written nutrition information can be provided. Again, we have tried to provide as much flexibility for covered establishments as we could in this rule. The establishment must also include a statement on the menu and menu board that this additional written nutrition information is available upon request. The statement must appear on the first page of a menu with menu items listed and the bottom of a menu board above, below, or adjacent to the succinct statement. Now, unlike the succinct statement, the written nutrition information statement is only required to appear once on a menu or menu board. And just to note, for a menu board, a multi-panel menu board that is in one place and can be viewed in a single view would also only require one succinct statement. The additional written nutrition information can be in the form of a poster, a tray liner, counter cards, signs, handouts, booklets. You can even have a computer kiosk in your establishment where the customer can access the additional written nutrition information. This information, though, is required to be on the premises of the establishment. If the item is a variable menu item or a combination meal, the nutrition information must be listed separately for each component in the variable menu item. And we believe this is appropriate because, as I've noted, we've allowed quite a bit of flexibility in terms of how this information is provided, and the constraints that you may have on a menu board really do not exist in this situation. Where the number of variations is large, for example, a pizza, the nutrition information is declared for the basic preparation and separately for each topping or other variable component. This lists an example of how the additional written nutrition information can be provided. In this case, you have a grouped declaration, raspberry or peach flavored iced tea. So you have 2 flavors here. But because the declaration would be the same for raspberry and peach, it is acceptable to list them together in the additional written nutrition information. Also, as you've noted here, we've identified a not a significant source of calories from fat, saturated fat, trans fat, cholesterol, and dietary fiber. So a shortened format can be used, and again, this is described in the final rule, but I would direct your attention to the proposed rule for more specific examples of how this can be done. Moving on to talk about determination of the nutrition content of food, one of the most controversial issues in the proposed rule was the discussion of the 80-120 rule. In the proposed rule, we described several ways in which the nutrition content of food could be determined. The law states that the establishment must have a reasonable basis for its declaration and referred the agency to the reasonable bases that are already listed in our existing regulations for restaurants and other retail establishments that make nutrition claims. We added in the proposed rule that if laboratory analysis was used, that we would apply the 80-120 rule standard that is currently used for packaged food. Well, we received a lot of comments opposing the use of the 80-120 standard. Many of the comments misunderstood the proposal and thought that we were requiring laboratory analysis for all nutrient declaration determinations. That was not our intent. But because of the confusion over the use of the 80-120 rule and the concerns raised in the comments, we were persuaded to not finalize the use of the 80-120 standard in the final rule. However, the other reasonable bases as listed on the slide are permitted. Our plan is to provide some additional guidance on considerations establishments should use in selecting a reasonable basis that works best for them. And I also wanted to specifically note here that while you see nutrient databases, laboratory analysis, a nutrition facts label, cookbooks, other reasonable bases, one can combine several of these if necessary to come up with the appropriate calorie and other nutrition information for their standard menu items. So you don't have to be limited to just a nutrient database. If you are using a cookbook and you also need to use a nutrient database, that is acceptable. What the agency would look for if we were to question the establishment would be that they have used reasonable bases, logical assessment, used the correct database for whatever food they are trying to determine their calorie and other nutrition information for. If the agency comes into an establishment and has questions about the nutrition labeling, calorie labeling, or the other nutrition information, then upon request from FDA, that covered establishment must provide information substantiating their nutrition values. And what does this mean? It means that the covered establishment will need to submit a signed and dated statement to certify that the information contained in their nutrient analysis is accurate and that it's complete. That's one certification. That certification can be done by a responsible individual at the corporate level or at the covered establishment level. The second type of statement that is needed would be one that certifies that the covered establishment has taken reasonable steps to make sure that how the food was prepared and served adheres to the factors on which its nutrient values were determined. Now, this second certification has to be signed by a responsible individual at the covered establishment, because that is where we believe someone can attest to what was done actually in the establishment. We've also given flexibility in terms of responsible individual. The covered establishment or the corporate headquarters really is in the position of determining who that responsible individual would be. This is our last poll question. Which of the following statements must be included on each page of a multi-page menu? A, written nutrition information available upon request. B, 2,000 calories a day is used for general nutrition advice, but calorie needs vary. C, A, and B. You're pretty good at this now, so you'll see the poll selection on the left side of your screen, and please select your choice now. Well, most of you got this one right. 59% said B and 32% said C. B is the correct answer. The succinct statement has to appear on each page of a multi-page menu. The written nutrition information statement only needs to appear on the first page of a multi-page menu that has standard menu items. So B is the correct answer. I wanted to just touch very briefly on the fact that this rule is preemptive of state and local law. And what that means is that no state or local jurisdiction can establish requirements that are not identical to the federal law. Now, this does not preclude a state or local jurisdiction from establishing their own labeling requirements, but those labeling requirements have to be identical to the federal requirements. If a state or locality does establish their own identical requirements to the federal requirements, then that state or locality can, on their own, enforce their own laws. What a lot of people are not aware of is that there is a provision in FDA's regulations that was established in 1993 as a result of the Nutrition Labeling and Education Act that allows states and localities to petition the agency to be exempt from the federal requirements. We refer to this as exemption from preemption. And I just wanted to alert everyone that we do have one petition currently before the agency from the City of Philadelphia that's requesting this exemption from preemption. The restaurant menu labeling provisions in the City of Philadelphia, among other things, require additional nutrients to be disclosed on the menu or menu board, not just calories. This petition is available at regulations.gov. I will quickly give you the docket number if you're interested in looking at the petition or submitting comments. The docket number is FDA-P-0646. I'll repeat that. FDA-2011-P-0646. We are currently evaluating this petition, although we have not made any final decisions. And as I noted, the docket is still open to accept comments. We proposed a 6-month effective date. We finalized a 1-year effective date. We were persuaded by the comments to extend the effective date for the rule. So the rule becomes effective of December 1 of this year. And we also have been getting questions in terms of, what the agency is planning to do in terms of implementation. And as I said, we are looking at how to move forward. We are in the process of developing a guidance for the industry. Now, some of you may have seen a small entity compliance guidance that issued last week. That really is just a restating of the final rule in plain language, and is to help assist smaller entities in complying with the regulation. We do have plans to issue a much more comprehensive guidance in the near future. This will be issued as draft, and we will take comment on it and then issue a final guidance. We're also working very diligently on completing our enforcement strategy, and we'll also communicate this once we have brought closure to that exercise. At this point, we are anticipating that the first year will be more focused on education and, helping covered establishments to comply with the rules. And like this webinar, we are very much active in meeting with stakeholders, attending conferences, and doing webinars. So we're hoping that, through all of these efforts, covered establishments will be able to ensure that what they're doing complies with the rule. And finally, we do have a mailbox set up where questions can be submitted. I just want to remind you, however, that questions are answered in the order in which they are received. We have been getting inundated with them, and it's a very small staff at the moment, but we are working through them and will certainly respond back to you. Thank you very much, and I'll turn back over to Shirley.
Thank you so much, Felicia, for that very in-depth presentation on menu labeling. We know that you have many questions, and please stand by. We will get to your questions. We thought we would have the vending machine calorie labeling presentation because it's much shorter, and so if you could bear with us until Dan Reese's presentation is finished, then we will allow the whole time for questions. I've looked at some of the questions. They are very, very interesting, so please bear with us, and I want to introduce Dan Reese at this time.
Thank you, Shirley. I am pleased to share with you some of the highlights of the vending machine calorie labeling final rule. To start off, a question for you. Many of you have probably seen calorie information in chain restaurants already, but have you ever seen a vending machine that listed calorie information before purchasing? Would you even find such information useful? The vending machine final rule, the vending machine calorie labeling, was also part of Section 4205 of the Patient Protection and Affordable Care Act. And as Felicia described, that was enacted about 5 years ago. It amends certain nutrition labeling provisions of the Federal Food and Drug and Cosmetic Act, and it requires covered vending machine operators to provide calorie information for articles of food and vending machines. 3 sentences in the entire act were devoted to vending machine calorie labeling. FDA issued proposed rules on April 6, 2011, and we received about 250 comments. Who must comply with the requirements? The rule applies to vending machine operators engaged in the business of owning or operating 20 or more vending machines that dispense food where the vending machine does not permit a prospective purchaser to examine the nutrition facts panel prior to purchase, or does not otherwise provide visible nutrition information at the point of purchase. Those who are not required to comply with the requirements are vending machine operators who operate less than 20 vending machines that dispense articles of food and who do not voluntarily register to be covered. The vending machine labeling final rule, published December 1st, 2014. It defines several terms. It identifies who must comply with the requirements, describes how calorie disclosure should be accomplished, and describes what food is exempt from posting calories. That is, certain information on the nutrition facts label, or otherwise provides visible nutrition information at the point of purchase. Machines that are covered are those that dispense articles of food, and machines that are not covered are vending machines that may dispense food as part of a game or other non-food related activity. Bulk vending machines are covered in the final rule, and this is a departure from the proposed rule where we had excluded bulk vending machines such as gumball machines. FDA received a number of comments stating that there was no public health rationale to exclude such machines. FDA was persuaded by these comments to include bulk machines in the final rule. The calorie declaration follows the same rounding rules as in packaged foods. The statement of the number of calories must be expressed to the nearest 5-calorie increment up to and including 50 calories, and 10-calorie increments above 50 calories. For foods that contain less than 5 calories, the calories may be expressed as 0. The term calories or cal must appear adjacent to the number of calories for the food. The calorie declaration should be in a type size no smaller than the name of the food on the machine, not the label, selection number, or price of the food as displayed on the vending machine, whichever is smallest. The color should be the same color, or at least a color at least as conspicuous as the color of the name or price of the food or selection number. And the contrast should be the same contrasting background as the item to which it is in closest proximity. Calorie declaration may be placed on a sign in close proximity to the article of food or its selection button. If it's adjacent to the vending machine, the sign must be visible at the same time as the food, its name, price, or selection button or number. Should the calorie declaration be total or per serving size? The answer is the total calories for the item as vended. For single serving foods, the number of calories declared must be identical to the number of calories that are on the nutrition facts label. For foods that contain multiple servings, the number of calories must include the total calories of the vended food article. Vending operators may voluntarily declare calories per serving in addition to the total calories for the vended item. Electronic vending machine displays are also a way of meeting the requirements of the rule. This includes machines with digital or electronic or LCD displays. Calorie information must be displayed before the prospective purchaser makes his or her purchase. These are machines that display the price and scroll to calorie information before inserting money. When is a vending machine operator not required to provide calorie declaration? If certain information, that is, total calories, serving size, and servings per container on the nutrition facts label can be viewed prior to purchase. This information must be easily readable. It must be fully visible without any obstructions, and in a type size that is easy to read while the food is in the vending machine. Continuing from the last slide, if a purchaser can view visible nutrition information, at a minimum total calories on the article of food, such as front of pack at the point of purchase, then the vending machine operator is not required to provide calorie declaration. This visible nutrition information must be clear and conspicuous, and in a type size at least 50% of the largest printed matter on the food label. Now to our poll question. How can a vending machine operator meet the calorie declaration requirements? A. Display a product with a front of package calorie label. B. Post a sign or sticker near the vended product. C. Program a machine to electronically display the calories prior to purchase. D. Post a quick response scan code for consumers to use with a smartphone. E. All of the above. Or F. Answers A, B, and C only. We will come back to this slide in a moment. FDA provided for voluntary registration for vending machine operators similar to menu labeling. A vending machine operator that is not subject to the requirements, such as operators with fewer than 20 machines, may voluntarily register with FDA to be subject to the requirements. The vending machine operator then cannot be subject to any state or local nutrition labeling requirements that are not identical to the federal requirements. States or localities may establish nutrition labeling requirements identical to federal requirements. States or local jurisdictions would then enforce their own requirements. Contact information requirement was included in the final rule but had not been in the proposal. This information includes the vending machine operator's name, telephone number, and mailing address or email address, and it must be readable and placed on the face of the vending machine or with the calorie declarations. FDA granted 2 years to comply with this rule, so that'll be December 1st, 2016. In the proposal, we had proposed a 1-year compliance date. This 2 years balances the industry's need for additional time with the public health need for this information. Now back to the poll question. Looks like you all have been paying very close attention, and 96% of you answered F, which is the correct answer. Those are the 3 ways to meet the requirements of the rule. And a QR scan code would not work because not everyone who is at a vending machine would have access to a smartphone to use a QR scan code. And as Felicia mentioned earlier, the next steps for the vending machine labeling final rule include developing guidance for industry. A small entity compliance guide will be published in the near future, and we are also working on a more in-depth Q&A guidance, which will be forthcoming. We are continuing to work on completing our enforcement strategy and continuing to meet with stakeholders. There's also a mailbox for questions coming in regarding the vending machine calorie labeling. You may submit those to calorie labeling vend, V-E-N-D, at fda.hhs.gov. Thank you for your attention and participation. I'll turn it back over to Shirley.
Thank you so much, Dan, for that very interesting presentation on vending machine labeling. And now we have quite a bit of time now to respond to your questions. We will I think we'll take them, we'll allow Felicia to come back and take her questions, and we may intermingle them if there's a vending machine question here and there so that you can hear from both Dan Reese and Felicia Billingsley. So just give us a second. We will begin to respond to your questions. There are quite a few questions. We thank you for being alert through the presentation and asking lots of interesting questions. So we will begin to respond to those questions. And while Felicia is coming back to the microphone, I want to again thank both Felicia and Dan for that most interesting webinar. Their presentations launched our 2015 webinar series. So here we are going to now begin to respond to your questions.
Thank you, Shirley. And as Shirley noted, we do have quite a few questions in queue. So what I would like to do is try to give each person that's asked a question at least one answer first, because we have several questions from the same participants. And also, if we don't get to your specific question during the allotted time, please submit your question through the email portal that we have set up. So one of the questions, I guess a couple of the questions that we received were related to our enforcement and our guidance. The question was whether we could give an expected date at this point of when we would issue our more comprehensive guidance. Unfortunately, I can't give you an expected date at this point. I can tell you that there are several staff that are working to complete this guidance as quickly as possible. But however, it does have to go through several levels of review. And at this point, we haven't been advised how far through government review it will have to go before it issues. But we do want to get it out as soon as possible. There will be an announcement of its availability in the Federal Register. I will warn you, however, because we are trying to get the final guidance out as quickly as possible, there will probably be a short window for comment, maybe 30 to 45 days. So please, just monitor the Federal Register and our website to be advised as to when the guidance comes out. There was also a question about how FDA is going to ensure aligned enforcement for all health jurisdictions. And that is one of the primary issues that we are looking at in developing our enforcement strategy. We have and intend to work with the states. We have been in touch with some of the states that actually have menu labeling in place now. And so going forward, we are certainly looking at how FDA will interact and interface with the states. Some states may decide to adopt their own requirements. As I mentioned, the opportunity is there for a state or local jurisdiction to do that. But as part of our developing an enforcement strategy, as with other areas that we enforce over, we do have compliance programs that lay out how we look at situations and what the expectation would be in terms of compliance. So we anticipate that there will be an aligned enforcement strategy across the federal as well as local and state governments. There was a question as to what nutrients are required to be in the nutrition information. That is clearly spelled out in the final rule if you do have a copy of it. But it's primarily those nutrients that are in the top portion of the nutrition facts label. The law referred to the nutrition facts label in terms of what information would be required. Vitamins and minerals are not required. So your macronutrients are those nutrients that are required for the written nutrition information for menu labeling. We have just give us a moment. Let me look at some of the other questions. Again, I'm trying to be responsive to at least everyone once. Okay, we have a question that are sandwiches made at an establishment like Subway, where all the sandwiches are custom exempt. Would the individual items, turkey, bell peppers, etc., need individual calorie disclosure? Establishments that operate under a concept like Subway would be covered, and those would be considered foods on display, and therefore would need to comply with the requirements for calorie declaration for foods on display. So even though the idea is that the customer requests various ingredients to prepare their sandwich, they are on display prior to the customer selection, and the declaration would need to be per item. Now, again, it would be dependent on how the sandwich is normally prepared. So if in your establishment on a 6-inch sandwich you place 3 slices of tomato, then it would be for those 3 slices of tomato. So it would be declared in terms of what is used to prepare that product. Another question, can you clarify something with the daily special? If I have a specific pizza slice that's only offered on Mondays, another that's on Tuesday, etc., these don't need to be labeled because they're only served 52 times a year. Yes, if you have an item that is not a standard menu item offered every day, and it is only offered on a particular day, and it is not offered more than 60 times throughout the year, that would be considered a temporary menu item. There was a question requesting clarification about how to declare calories for a self-serve buffet that's part of a combo meal. So if you have a combo meal on your menu board, and as a part of that you get a salad that is actually a self-serve salad at a salad bar, the regulation does have guidance in it. The rule has information in it that if you have a self-serve item that has no upper bound, like a self-serve salad bar, what you would put on the menu board is see salad bar for calorie information. So the calorie declarations that would actually appear on the menu board would be for that portion of the combo meal that is prepared and served by the restaurant. The statement for calorie information regarding the salad bar, seed salad bar, would also need to be included as a part of your menu board. And then at the salad bar, you would have the declarations for the items that are offered at the salad bar.
Okay, we're going to bring Dan Reese up while Felicia is going through more questions. Please stand by. She will come back and answer additional questions. But some people sent in questions for the vending machine calorie labeling presentation, so we'll allow him to come in and give his answers at this time.
The first question was, does a company that has vending machines for their employees to use have any responsibility with the vending machine labeling if they do not own the machine? First, we can go and look at the definition of a vending machine operator. And we said a vending machine operator means a person or entity that controls or directs the function of the vending machine, including deciding which articles of food are sold from the machine, or the placement of the articles of food within the vending machine, and is compensated for the control or direction of the function of the vending machine. So it depends on who is operating the vending machine. If the company is making the decision, who is making the decision to stock what's in the machine? If they are not making that decision, then that company would not be the operator of the machine. They said they're not owning the machine either. So whoever operates the machine, who makes the decision of what is sold in the machine, will ultimately be responsible for providing the calorie declarations. Hopefully that answers your question. Another question we received, are beverage vending machines covered? Yes, beverage vending machines are covered. They sell articles of food. And then one other question we received, are there specific requirements for prepared foods and vending machines? There is nothing different for prepared foods versus packaged foods. They're all required to have the calorie information if they have 20 or more machines. Prepared foods and vending machines could be prepared sandwiches, and like packaged foods, they would have to have that calorie declaration. They could get that calorie information from the vending machine operator could get that from the company that makes the sandwiches if they have that information readily available. They could also use nutrient databases or other reasonable bases.
All right, thank you. Thank you very much, Dan. And we can switch back now to the other menu labeling questions. We want to try to get to as many questions as possible during this time period. So stand by, and Felicia is returning to answer some additional questions.
Okay, we had one question where the participant was confused by what is meant by no establishment is required to redesign the menu board. Wouldn't most need to redesign to accommodate the calorie labeling? And the point that I was really trying to make there is that, yes, there will likely be changes that a restaurant will need to make in order to have the calorie information on their menu and menu board. If they do not already have a menu or menu board, the law does not require them to create one. That's one point. The second point is that there is no specific format or criteria that a redesigned menu and menu board would have to meet. So yes, if changes have to be made to a menu and menu board to meet the requirements of the law with regard to calorie declaration, yes, there will be some redesign within that, but the redesign does not have to be in a specified format. And in some cases, it may be that there's a way to actually sticker a menu or menu board to put the calories up there. So there's a lot of flexibility in how the establishment can meet the requirements of the rule. There were also questions, a few questions around how to list calorie declarations for beverages and serving sizes for beverages. I'll give sort of a brief overview there rather than reading all of the specific questions around that. There are two types of declarations that a covered establishment would need to consider for beverages. First, is it a beverage that is prepared by an employee of the covered establishment, or is it a self-serve beverage? I'll start with the self-serve beverage. If you have self-serve beverages and they're at a dispenser, the calorie information has to be at the dispenser as well as on the menu board if the menu board lists the varieties and flavors that are available. If the menu board simply says soft drinks, then a range can be used. At the dispenser, as well as on a menu or menu board where the beverages are self-serve, The calorie information has to be for the capacity of the cup, and it would be per size. So if you have a large cup and it holds 32 ounces, then the declaration would have to be for 32 ounces. If it is a self-serve beverage, the calorie declaration is not dependent on whether the customer adds ice or not. It's based on the cup size. If, on the other hand, the beverage is dispensed by the employee of the establishment and the establishment has a uniform ice fill, and they know what that uniform ice fill is, then that can be factored in to what the declaration would be for a cup of that beverage. And it would still be for each size of the beverage. If the establishment does not have a standard ice fill, then it would be for the entire contents of the cup. So I hope that cleared up the questions around beverages. We had a question on what are the requirements for a responsible individual, the person who is qualified to establish nutrition info. The law speaks to a responsible individual in two cases. In both of those cases is where the FDA requests certification. As I mentioned, the FDA will not decide who that responsible person is. That really needs to be done at the level either of the corporate level or at the store level. And this is a person who has some type of oversight or management over how the nutrition information or what reasonable basis was used. It does not mean that they were actually the person that did the analysis, but they can certify that the analysis was done in a manner that was accurate, that the correct reasonable basis was used for the particular product or food, and that they're attesting or certifying that the information is true. The second certification is completed by a responsible person at the covered establishment. Again, that is something that is determined by the covered establishment. Whoever has information or oversight or management control over how the foods are prepared and served would seem to be a reasonable person that would be designated as the responsible individual. So FDA will not decide who that is. That's left to the covered establishment. We had a question regarding whether micronutrients can be included in the written nutrition information. Yes, they can voluntarily be included, as they're not required, but they can be included. We got a question regarding, I guess, amusement parks and whether facilities within the amusement park would be covered. And what I would recommend is that to determine if a facility is covered, you want to always go back to those four primary criteria. That's a restaurant or similar retail food establishment that's selling restaurant type food, part of a chain with 20 or more locations doing business under the same name and offering for sale substantially the same menu items. And I think if you always go back to first judge the establishment in question against those four criteria, it will be clear to you whether the establishment is or is not covered. We have one question for foods on display. What basis should the additional written nutrition information be derived on? That is it on the basis of the unit displayed or on the basis of a serving as determined by the rack for the food? No, we have not established or applied reference amounts customarily consumed for packaged foods to food served in restaurants. Whatever basis is used to determine the calorie declaration would be the same basis that's used for the additional written nutrition information. And it goes back to how the covered establishment prepares and offers the food for sale. We had another question. Do self-service packaged sandwiches and sushi in a display case at a grocery store fall under the law? They usually are labeled with nutritional information but not calories. Same question for individual packages, pastries, and cake pieces. I think here again you want to first go back to see if these foods qualify as a restaurant type food. So I would encourage you to look at that definition. It really depends on where the food is processed and prepared. It depends on how the food is offered for sale, and it depends on whether it otherwise meets those criteria for a restaurant type food. One thing that I would also encourage you to consider is that this amendment to the Federal Food, Drug, and Cosmetic Act amended the section under NLEA that previously exempted restaurant and similar foods from nutrition labeling. So if the food already requires full nutrition labeling, it was not exempt under NLEA. Therefore, it doesn't really fall under the framework of those products that are covered now. We have one question. We interpret the law as including gas station mini marts. Is this correct? They usually have soda fountains, coffee pots, and specialty coffee dispenser machines. We assume they need to list calories for these. Again, go back to the 4 criteria. Are these mini marts a part of a chain of 20 or more locations, doing business under the same name, offering for sale substantially the same menu items, and selling restaurant type food? If you have mini marts that are doing business under different names, and there aren't 20 or more of those, they likely would not be covered. So you really need to apply those 4 criteria to see if the establishment would be covered or not. Once that determination is made, then you would look to determine what in that establishment is considered restaurant type food. Okay, just to clarify, for a buffet type place like Panda Express, where the items are listed both at the menu board and at the display case when the customer orders, they can place a statement on the menu board referring to the calorie info that is listed at the display case. They do not need calories at both places. In this case, if the menu board is visible at the same time that the customer is selecting whatever they want out of the display area, then the menu board will suffice as the sign, provided it can be viewed at the same time. In other situations, however, let's say that your menu board was at the front of the store and then you walk through to select your specific menu items, the information would need to be in both places. So just because you have a menu board that lists the items on display, you would also need to have calorie declaration for those individual items if that sign cannot be viewed at the time that the selection is being made. The only time that you can have a statement that refers to a bar would be a self-serve situation where there is no upper bound, meaning that it's all you can eat and you can go back as many times as you want. That is a type of statement that can be on a menu board that refers the customer to the actual food on display or self-serve food. But if it's on display and even on the menu, it would have to be in both locations. Unless you can view the sign at the same time you make your order selection. So we're going to turn over to Dan again.
The next question we have, actually, I will look to Felicia for a little bit of elaboration. The questioner is asking a question about front of pack labeling. Does FDA consider front of pack to be a nutrient content claim? We do. The questioner then goes on to say, if so, please explain why the type size requirement for such front of pack calorie labeling varies from the existing nutrient content claim type size.
All right, I think we first need to maybe clarify the provision for vending machines. The discussion or provision of front of pack labeling for food sold from a vending machine is really an approach that offers an exemption to the vending machine operator. The law itself did not put any specific criteria on the use of front of pack labeling in terms of meeting the requirements for the vending machine operator. So yes, nutrient content claims are voluntary information. If you have a statement on the front of a package, it is considered a nutrient content claim. The reason that there are criteria specific to front of pack labeling in the case of the vending machine rule is that it is the presence of that declaration that is exempting the food from otherwise being covered by the vending machine rules. In that case, there needs to be assurance that that front of pack labeling will be visible, will be easily readable from the vending machine, and will provide the information clearly to the customer. So the rule itself does not address, if you will, criteria or requirements for nutrient content claims. It says that if you want to use a front of pack claim to meet the requirements of the vending machine rules such that the vending machine operator is not required to disclose calories, that statement needs to meet certain criteria. Again, you know, as Dan mentioned, the requirement for vending machines is really on the vending machine owner or operator. It is not on the manufacturer of the packaged food. So allowing statements that may be on a packaged food to meet the requirement under the vending machine rule, we needed to ensure that that information would be visible and would be tied to other information that is mandatory for food packaging, and that's why we tied it to the size of the statement of identity, which is to be 50% of the largest print on the label. So I hope that answered the question.
Thank you, Felicia. Another question we received for vending machines: are vending machines for employees only and not for the general public, also required to have calorie labeling? The short answer is yes, if the vending machine operator has at least 20 or more machines. So the rule does not distinguish whether the machine is for general public use, for private use. It is any machine. They have 20 or more machines, then they are covered. Another question we received, what about vending machines used to sell school meals like breakfast in high schools? The vending machine calorie labeling final rule does not cover vending machines in schools. We are covering vending machines that would be in college campuses, but not schools that would be secondary or primary schools. We decided not to cover those simply because USDA has jurisdiction in those areas, and they have their own criteria for what is allowed to be sold in vending machines. So for those reasons, we did not cover vending machines in schools. Felicia is looking at some more questions, and in a moment she will be back with some more answers.
Well, we will go for the full time allotted. We will go until 3 o'clock. We are now looking at all of the questions that we have not already answered. So that takes a little bit more time to go through the questions again, going back from the beginning to look at the questions, some of which we answered and some of which we did not, just to make sure we catch all of the different questions that have been raised. So please bear with us. We'll be right back. So we're putting up again the contact information and the mailbox address. In case you did not get it the first time around, we're just going to leave it up on the screen. In case your question is not answered, you can put your question in the mailbox as it's addressed here, calorie labeling at fda.hhs.gov.
And this is Kyle. We will be sending a follow-up email after today's webinar that will include this email address as well as calorie labeling vend at fda.hhs.gov, which can be used for vending, as well as a URL on the FDA website that you can use to find your own answers as well. And that will be in a follow-up email we will send later today. So while we're taking a pause for some more questions, I know a lot of you will have questions on how to obtain your CPE credits. You will receive an email in the next 2 weeks that has an assessment that we're going to ask you to fill out. At the end of that assessment, you will be able to have instructions on how to get your certificate and obtain your CPE credits. I think in the email that we sent out earlier yesterday, we did say a date that you should expect to hear from us by. And if you do not hear from us, once again, you can always contact GIFSAN IT support at umd.edu if you have any questions regarding that. Okay, and I believe we are ready to continue with questions.
Yeah.
We had one question that asked for examples of how best to display required calorie info on soda fountains, especially for facilities like 7-Eleven who do not have traditional, I think, menu boards, but still several varieties and flavors of sodas. And this is a question, we can't actually do that right here, right now, but this is one that we will include in our guidance. After this week, if you have questions that are more broad in nature and you get them into us this week, we will try and incorporate those into our guidance. But anything after this week, we'll just be responding back to you directly. So we will ensure that we have some graphics or at least description of how calorie declaration can be accomplished in response to that question. The next question on restaurant menus is disclosure required for nutrients that exceed disqualifying nutrient levels per rack. There is no requirement under the menu labeling, provisions that require disclosure levels or information on disqualifying levels. The menu labeling law is requiring calorie information for standard menu items and is requiring additional written nutrition information. That's it with regard to any type of nutrition labeling. Any other information that you might have on your menu, you want to look at our claims provisions, because if you make claims on restaurant foods or restaurant type foods, there may be additional information that is necessary, particularly for foods that are not covered by the menu labeling requirements. For those foods that are not covered by menu labeling, that are still exempt under the NLEA labeling requirements, if you do make a claim, then you need to abide by the provisions that are in 21 CFR 101.10. Those provisions have not changed, but there is no requirement under the menu labeling laws for disclosure levels or information about disqualifying levels. We had a question. Is there an idea on when chains smaller than 20 locations or an individual mom and pop restaurant would be required to comply, or will they stay on a voluntary basis for the foreseeable future? I mean, the law indicated that the covered establishments would be those that have 20 or more locations, and anything less than that would be covered only on a voluntary basis. FDA doesn't have any plans to approach Congress to change that. So unless Congress changes the provisions of the law, it will remain that chains under 20 will only be covered if they choose to voluntarily register. Now keep in mind, if you are a chain under 20, but you add additional locations, once you cross that 20 threshold, you would then be considered a chain that's covered under the menu labeling requirements. We had a question on who enforces these provisions, and I touched on that a bit during the presentation. This is a federal requirement, and thus it is FDA's responsibility to ensure that these provisions and the restaurants and covered establishments are in compliance. We do have situations where we contract or coordinate with state and local governments to act on our behalf. And as I mentioned, we are in the process now of completing an enforcement strategy. And whether that will be the approach that we ultimately take in terms of working with the states to enforce this, or whether FDA itself will enforce it. We will certainly advise on how we plan to proceed in that manner once we have completed our enforcement strategy. We also had a question, if I could clarify, if in order to be considered a menu board, it must have all three components: name, price, location, where a consumer can make a decision and order. It needs to be a primary writing from which the consumer can place an order. And the regulatory language actually says be or be part of the primary writing where a consumer makes an order selection. So yes, it would need to have information on the item. It would need information on the price. But in some cases, it may be a part of a menu or menu board that just lists the flavors or varieties of an ice cream. You still need that information to place an order selection. So while we try to provide clear guidance on traditionally how you look at a menu board, it's not to say that a board that may sit next to your primary menu or menu board that has all of the flavors of ice cream that may be available in your store would not be considered to be a part of the primary writing for the consumer to use to make an order selection. We have another vending machine question.
This question states, for small vendors who are not required to provide nutrition information, how are those items' calories to be determined? So if you do not have calorie information provided from a nutrition facts label or from the vendor, then FDA has provided ways for you to find that. You can use a reasonable basis. Reasonable basis could be nutrient databases. USDA has a nutrient database. FDA has some nutrition information in its nutrient database for fruits and vegetables. You could use a private nutrient database out there. You can use, FDA stated in the menu labeling rule, you can use cookbooks. You could, if you needed to, you could do laboratory analysis. So FDA has provided flexibility for how you can obtain the nutrient information.
Well, this is Shirley Blakely, and I want to thank the audience for sending in such wonderful questions. They were certainly asking for more clarification on the presentations, and I think we received that. We've actually come to the end of the new questions, so I think we might as well go ahead and thank our speakers for giving such wonderful presentations, as well as answering all of your questions. You know, you have the contact information, and you can submit additional questions if your particular question, or if you have another question that did not get answered. But I think we've covered all of the questions that are listed in the chat area. So I want to go ahead and thank you for attending the webinar. Thank our speakers who did such a superb job of the presentations, and invite you to submit any additional questions that you have to the calorie labeling at fda.hhs.gov. Thank you again, and we will go ahead and sign off at this point. Goodbye.